Hi, my name is Dr. Olivier Carcuac on Dental Tools. Today I'm gonna speak about optimizing aesthetics for implant restorations in the anterior maxilla. Over the past 10 years, dental aesthetics has been an important issue in implant dentistry. At major conferences, it's common to see lecturers addressing various techniques for obtaining aesthetic implant restorations. In the anterior maxilla, unsuccessful treatment outcomes can lead to disastrous clinical situations, as you can see on this slide, that can only be corrected with removal of the implant and subsequent tissue augmentation procedures. With this in mind, it's important to establish sound clinical concepts with clearly defined parameters that lead to successful aesthetics in the anterior maxilla, with long-term stability of the peri-implant tissues. This webinar addressed these aforementioned concepts and parameters from an anatomic and surgical perspective. Aesthetic parameters that have been defined for conventional dental restorations can also be used for implant patients during preoperative planning. These parameters can help define potential risk factors for the aesthetic shortcomings. The main aesthetic objectives of implant therapy from a surgical point of view are the achievement of harmonious gingival margin without abrupt changes in tissue height, maintaining intact papilla, and obtaining or preserving a convex contour of the alveolar crest. Implant therapy in the anterior maxilla is challenging for the clinician because of the aesthetic demands of patient and difficult pre-existing anatomy. In this aesthetic area, the clinician is often confronted with tissue deficiencies caused by various conditions. These conditions can be divided into two categories, anatomic and pathologic. Tissue deficiencies often require bone augmentation procedures such as the guided bone regeneration technique, which use a simultaneous or stage approach to regenerate adequate volumes of bone to allow for implant placement. Soft tissue handling, precise implant placement in a restorative-driven three-dimensional approach, and follow-up procedures represent a variety of challenges for the implant surgeons. To successfully meet the challenges of aesthetic implant dentistry in daily practice, a team approach is advantageous and highly recommended. The team includes an implant surgeon, a restorative clinician, and a dental technician who preferably has advanced knowledge and